Hi everyone, my name is Jamie Batista, and I will be going over binge eating disorder with everyone today. According to the Francis text, binge eating disorder was created to diagnose people who have recurring eating binges without the activities like vomiting and laxative use seen in other disorders such as bulimia nervosa. Some of the diagnostic features is the essential feature of binge eating disorder is recurrent episodes binge eating that must occur on average at least once per week for 3 months. A mild case of binge eating disorder is 1 to 3 binge eating episodes per week. Moderate would be 4 to 7 binge eating episodes per week. Severe would be 8 to 13 binge episodes per week. And extreme would be 14 or more binge eating episodes per week. Associated features supporting diagnosis. So binge eating disorder occurs in normal weight, overweight, and obese individuals. No higher or lower the weight is not affected by this, or they're all affected equally. Prevalence, 12-month prevalence of binge eating disorder among U.S. adult females is 1.6%, and males is 0.8%. Binge eating disorder appears to run in families, which may reflect addictive genetic influences. The next, I'm going to go over the DSM binge eating disorder criteria. So if the person, there's A through E, if they meet this criteria, then you can go ahead and diagnose them with binge eating disorder. So, excuse me. Recurrent episodes of binge eating. An episode of binge eating is characterized by both of the following. 1. Eating in a discrete period of time within any 2-hour period, an amount of food that is definitely larger than what most people would eat in a similar period of time under similar circumstances. And a sense of lack of control over eating during the episode. An example is a feeling that one cannot stop eating or control what or how much one is eating. So for number 1, eating it in a discrete period of time within any 2-hour period, you did see that in the bulimia nervosa one as well, but like I mentioned in the last slide, it omits the part where vomiting or laxatives are used. So this part B is the binge eating episodes are associated with 3 or more of the following: eating much more rapidly than normal, eating until feeling uncontrollably full, eating large amounts of food when not feeling physically hungry, eating alone because of feeling embarrassed by how much one is eating, feeling disgusted with oneself, depressed, or very guilty afterward. Part C is marked distress regarding binge eating is present, so they aren't happy about the eating. I mean, they're in distress after the binge eating is taking place. The binge eating occurs on average at least once a week for 3 months. And the last part E, is the binge eating is not associated with the recurrent use of inappropriate compensatory behavior, such as in bulimia nervosa, and does not occur exclusively during the course of bulimia nervosa and anorexia nervosa. Okay. The next slide, I'm going to go over the article that I picked, which is really, it's just like it was not specifically binge eating disorder, it was eating disorders in general, but I thought that it was interesting, and the results were kind of specific to binge eating disorder. So, adverse childhood experiences, ACEs, are restricted food access have been associated with risks for eating disorders for years. So, animal models have long suggested that severe dietary restriction increases the risk for binge-like eating behaviors after stress exposure or a long period of restricted access to food. So, when they studied animals for years, if the animal was deprived of food or have any restricted dietary in the study, they found that binge eating behaviors were after that. So, echoing these preclinical findings, recent studies have found that food insecurity, defined as limited access to adequate food, due to insufficient money or other resources was significantly associated with binge eating disorder and bulimia nervosa. The study examined the relationship between childhood food neglect and ACE, specifically involving restricted food access, and DSM-5 defined eating disorders in a nationally representative sample of U.S. adults. So 36,145 individuals were studied. In this case, the study was the first examination of the associations between a history of childhood food neglect and meeting a lifetime diagnosis of the DSM-5 defined anorexia nervosa, bulimia nervosa, and binge eating disorder, using the largest nationally representative sample of U.S. adults with psychiatric data. Findings suggested that the lifetime risk for each of the three DSM-5 defined eating disorders were significantly greater in individuals who report a history of childhood food neglect. Prevalence estimates anorexia nervosa, bulimia nervosa, and binge eating disorder with a history of food neglect were 2.8%, 0.6%, and 3.5% respectively, versus 0.8%, 0.3%, and 0.8% for respondents who denied a history of childhood food neglect. So those who did have food neglect were 2.8 versus 0.8, 0.6 versus 0.3, and 3.5 versus 0.8. So there was a pretty significant percentage difference in that data. Therefore, the findings showed a clear correlation that ACEs are associated with eating disorders and the risk of developing eating disorders in your lifetime. These findings were used to inform earlier detection and prevention efforts for eating disorders and speak to the need for public health and societal policy programs to reduce all forms of child maltreatment, including food neglect and insecurity. Here are some condition-related YouTube videos that we found on binge eating, anorexia, and bulimia. Please take the time to watch them. They all give a snapshot of eating disorders pretty well. Here are some national web resources on eating disorders as well. And lastly, here are our references. We would like to thank you for watching our presentation on eating disorders.